Could you just clarify for me, maybe I've missed it, how would a single payer be actually paid for? Would it be paid for out of, is it proposed out of general taxation? And would that general taxation be actually come more from those who are making all the wealth rather than those who aren't?
His question is, can we talk about how the single payer system would be financed? What are the taxes that will pay for it? And I think we were here when I said in the beginning, one of the weaknesses of Jayapal's new bill is she stripped out 4 progressive taxes that were in HR 676. And Bernie did the same thing 2 years ago. There's just no information about how Bernie or Pramila proposed to finance their bill. And I think that's not a good idea. I think they made the judgment that it makes the bill more passable. HR 676 had 4 progressive taxes, a surtax on the income tax. I think they had a sales tax on stock transactions, 2 others. Yachts, no, it wasn't yachts, but it'd be something that hits, it is progressive. John Marty has written his bill simply to say, we're going to finance single payer in Minnesota with a combination of premiums paid by individuals and taxes paid by business, and both have to be progressive. And that's it. He leaves it to the single payer board to figure that out.
So on the question of people actually, that contributory principle, really then, how does that apply if people have to pay a premium? What happens when they can't afford to pay a premium? Is he proposing that they get credits? Or, I mean, how does sort of premiums actually work out in practice? I'm not sure.
Now, we could write that into the bill. Again, that's one of those issues that we can debate whether we're helping or hurting ourselves by writing it in. But here's an example. We could, and progressive means, to most people, that you're not hitting poor people who can't afford to pay it.
Yeah.
That's what we're upset about by sales taxes. They hammer, everybody's got to pay it. A good single payer, or a good progressive tax of any sort would not even start till you've moved up to, I don't know what, 150% of poverty level. 25,000 for a family of 4 maybe. You don't, it blinks on at a certain level where, and then it's small and it begins to creep up until you're at Warren Buffett and it's a much higher number. That's what a progressive tax is. And it's a good question. Why would you want poor people to pay anything? That's why it's such an important part of any evaluation of a universal coverage bill. Because a lot of poor health is caused by poverty.
Yeah.
And it would be a horrific injustice if we were to pass a universal coverage bill and finance it by putting poor people deeper into poverty.
Yeah.